If you started having any form of treatment like chiropractic, physio, osteopathy, especially chiropractic, and you start off well and you start immediately feeling the benefits and you feel better, you have less pain, etc. And then a few sessions down the line, the pain comes back, or you get a new pain, or even an old pain that you had before, maybe 10 years ago. Why does that happen? And does it mean it's not working? So this is a question that I think is important to address because it happens to a lot of people. Firstly, this is a normal part of the process. It's a normal part of the healing process, but I want to explain to you exactly why that is and what happens and what causes it so that you know. So in some cases, people just, especially very simple cases, you know, your back's not been bad for very long, or your neck or the headaches or whatever, it's quite recent, maybe there's an obvious reason for it, like you twisted badly or something, then it usually responds quite quickly and usually that's it, it's gone. But if we're talking about a problem that's been there for a long time, then it's a different kettle of fish. Here's why. So, first of all, unless your back pain, say, is the result of a direct trauma, like someone kicked you in the back, or you fell off a chair, or you fell off a horse, or off a ladder, or something like that, so you can pinpoint it, this is why, it's a really obvious traumatic way that I hurt myself. But instead, it just kind of came on for no reason, or it got triggered by something really silly, like I just bent down to tie my shoelaces and off it went. That means that the pain you feel is not where the problem started. So the pain you feel is not where the problem started. And the problem might have started a lot longer ago than you think. In somewhere else. There could have been an issue with your neck, that maybe you had a stiff neck for a while, then it seemed to go away, but then you got a bad back. Here's how that works. A lot of the problems, a lot of the aches and pains, even the wear and tear and arthritis in the body, the places where that happens is usually a compensation for something else that's going on that the body's trying to shift away from in order to take the pressure off that. And it can do this several times. So a really obvious example is if you twist an ankle, say, or even if you just got a stone in your shoe or something like that, you might take some weight off that side, and you might, without realizing it, just take a bit more weight onto the other leg. Maybe not a stone in your shoe because you need to look at it over a period of time. But say you've got a twisted ankle. So now you're taking a bit more weight on the other leg. Now, if that doesn't correct itself, say that twisted ankle never fully got better and you never really put the weight on both legs again, now you've got 60-70% of weight on the other leg. Eventually, you're going to get a dodgy knee, or it might be hip pain, or it might be bunions, or it might be some issue down that side caused by the increased pressure because you're taking the pressure off the other thing. Now, I mean, that's a really obvious example just to kind of illustrate the point, but imagine that happening in the spine. Look at it, it's complicated. So there's loads of moving parts here, and the same principle can happen here. So say something goes slightly out of, we call it out of alignment up here, say for example. Well, what will happen is, in order to correct that, although it's not correcting it, it's compensating for it, the body will form another twist somewhere else. And that'll take the immediate pressure off those tissues, those muscles, ligaments, tendons, joints. So that'll feel a bit better because it's taken the pressure off the sore bit. Now, what happens is, maybe weeks, maybe months down the line, this bit starts to get irritated. You may get a bit of a niggle and it goes away, and what's happened is somewhere else. So it doesn't always follow this pattern, it could be anywhere. Because the tissues are overloaded, they've got the wrong kind of stress on them that they don't want to have. It might get inflamed and sore, and eventually, if it goes on long enough, maybe even arthritis, because the pressure on the joint is the wrong pressure that it's designed for. And that's when you normally go and see someone. So when you first start having any form of treatment, especially kind of manual therapy, what happens is when we free the area up and take the pressure off the sore bit, immediately you'll feel better, especially if you're looking after yourself, like you're using ice and staying active and all the other advice as well. But you've taken the pressure off the sore bit, now it feels better. If you leave it at that, that's what we call a patch up. So that means that you got what you wanted, or what you thought you wanted, which means you just want to feel better. You want to be able to go back to work and pick up your kids and play golf, etc., all those cliches. But that's often why people come in. The problem is we haven't actually gone back and corrected all the reasons why that happened in the first place. So that pain relief is great, but it might last a few days, might last a few months, who knows? But what will happen is it'll go back. Now, if you continue to follow a course of corrective care, so that might be over a period of a few weeks, 6 weeks, 12 weeks, however long your practitioner's recommended, then eventually by what they're trying to do is correct the other things down the line. So they're not just working on the bit that hurts anymore. They're correcting the next thing they find, which might be up here, which might not even have any pain there, or it might be here, or it might be something else. What happens then is during that process of unwinding is that you end up inadvertently putting pressure back on the sore bit temporarily while the body shifts and changes position and adjusts and adapts as it gets better. That means temporarily you might get the same symptoms, the original symptoms like back pain, you might get that again. And it's very easy at this time to get a bit disheartened and think, oh, I've gone back to square one. You haven't. It's a normal part of the healing process, and this is where it's really important to talk to your practitioner about it, because they can explain this. They can explain why this happens and the fact that it's just temporary, and it actually means that your body's adjusting and adapting and actually getting better. If you go through that process though, and again, you use ice, you take it easy when you need to, you'll find it might happen 2 or 3 times, everyone's different, but eventually will correct the entire system so that now the problem is actually solved. Now it's not something that's just going to keep happening again and again and keep getting triggered by silly little things. And that's how you break the cycle of chronic back pain in a lot of cases. That's why a lot of people end up going round and round in circles. And it's also why some of the, I'll be honest, like some of the hardest patients to treat are people who've been to see someone a year ago, 5 years ago, 10 years ago and said, oh, I went and saw they fixed it in 1 session. So now 2 things have happened. So that person has expectations that it will be fixed in 1 session, which rarely happens, and they don't understand that all that the practitioner did was take the pressure off temporarily. They just patched it up. They didn't fix anything. But, you know, eventually the pain comes back. So this is when we need to talk to people about it, about how it actually works. So if you're having treatment and your back pain's got better, and then it gets worse, then it gets better, then it gets worse, or it keeps coming back, talk to your practitioner, but this is why. So I know I've gone into a bit of depth here, but I thought you might like to understand the anatomy about how it works. And I hope that makes sense. If you've got any questions about that at all, just leave a comment down there or get in touch. I'll see you soon. Take care.